Okay, this is a video just one of my viewers told me recently, sent me an email that Dr. Greger is talking about metabolic endotoxemia and brain damage. Okay, I've been talking about this for a long time, and this is a big deal. You know, Greger's real smart. You know, he reads a lot, so he knows a lot. But the reason I'm bringing it up again is anytime Greger talks about something, now a lot of people start knowing it. When I talk about something, hardly anybody watches my video. A few hundred people, and you know how many of them get it? About half of them, okay? So they don't know it, okay? It's in all my books. I've been writing about this for a long time too. But now that he's talking about it, it'll start becoming more part of the vegan world consciousness. So what's happening is when you got leaky gut, especially if you're eating animal foods, you're going to get bacterial endotoxins, LPS, lipopolysaccharide from gram-negative bacteria, LTA from gram-positive bacteria into the blood. And Greger talked about how, you know, there might be some direct toxic effect, okay? And there certainly is. The reason is when you have leaky gut, you're going to have leaky blood-brain barrier, which means that the LPS and LTA get access to touch the surface of the brain, then the brain defense cells, the guard cells, security guards, the microglia, macrophages of the brain, part of the immune system, they will bind to that LPS and LTA with pattern recognition receptors, PRRs. And those will go, uh-oh, incoming bacterial invasion, because that's what it means to them. That's a bacterial invasion signal. And they're going to release their toxic chemicals to sterilize the area, the vicinity, and it's going to cause some collateral damage to the adjacent brain cells. So you do that every day for 30, 40 years, you're going to lose a lot of brain cells. Your brain's going to shrink, become atrophic, and you're going to be stupid. All right, and there's more to it than that. I've talked about this also, you know, the work of Douglas Kell, PhD from England, and Etheresia Pretorius, PhD lady from South Africa. They did fantastic work. They deserve a Nobel Prize, but they'll never get it. But they deserve it for figuring out amyloid clotting, fibrinolytic clotting, whereby the LPS and LTA cause a change in the secondary protein structure, the biochemistry of the fibrinogen, the clotting protein. It changes from alpha helix, like a cylinder, to beta pleated sheet, like a deck of playing cards. They stick together. The larger molecular weight of a molecule in aqueous solution, meaning the plasma of the blood, the more likely it will precipitate. To precipitate is to clot, and you form these microclots. Call them amyloid microclots or fibrinolyte microclots, size 2 to 200 microns, and they're plugging up little capillaries and arterioles in the brain and the heart. I think, you know, based on the work of Douglas Kell and Etheresia Pretorius and just my logical knowledge of pathophysiology, this is a major contributor to brain damage and to atrial fibrillation and to destruction of tissues, organelles all over the body. Because it's plugging up your arteries, and these clots, the fibrinolyte, amyloid clots, they're relatively refractory to lysis. Amyloid just means a protein that's had a change in its secondary protein structure, okay? Primary protein structure is a sequence of amino acids. Secondary protein structure is things like segments that are alpha helix or beta pleated sheet, okay? Tertiary is like the overall protein folding structure, and then quaternary is when two separate units of protein come together to make a, you know, they're a complex of proteins. Okay, so anyways, you can watch Greger's video. I'll put a link in the description below, and this helps to introduce you to the topic of postprandial. Prandial means to eat, so after eating, endotoxemia. Endotoxemia means bacterial endotoxins elevated in the blood, and this is a major cause of disease. So what's the point of all this? You want to minimize leaky gut, and you want to minimize dietary fat. That's the point of it. And you don't want to eat anything from an animal. Don't want to eat any oils. You want to avoid processed foods. And don't take NSAIDs if you can avoid it, or aspirin if you can avoid it. I realize there's sometimes when the benefits might outweigh the risks. But anything that contributes to leaky gut. Alcohol is bad for the gut. Tap water is bad for the gut. You want to filter it to get the fluoride and the aluminum out. They're both toxic to the gut. So anyways, I'll put the link to it. I hope you find it helpful.